Thank you. My name is Sebastian Majewski. I'm heading a small but mighty team at the Bill and Melinda Gates Foundation that is around the creative and around the brand of the foundation. And we've just walked from very individual to this more broader level, and now I'm going to take you to the most macro perspective that I can kind of bring to the table. I'm by training a graphic designer, but I have an interesting love-hate relationship with data. And I just try to make it beautiful. And my favorite data set is data about humanity over time. So what I want to show you a little bit is an argument that I'm trying to make, which is the best time to be born is now. So I want you hopefully to walk away from this session feeling a little better about the world. And it's hard, right? It's hard because in our daily news cycle, we're confronted with negativity. Every time we open the news, we know something bad is happening. And taking a step back and looking at this data on humanity gives you the chance to actually see some patterns in development that you wouldn't see normally. So I want to start off by showing you a chart that just shows you the dramatic reduction in under 5 mortality since the year 1990. So on the left-hand side, you see data from the Institute for Health Metrics and Evaluation looking at roughly 55 million deaths in 1990. 12 million of these 50-something million were children under 5. And what you see in the color coding there is that everything that is purple are infectious diseases, diseases that we can prevent with the tools that we mostly have today. And then you see the blue and you see the yellow color coding, and you see the legend. It's about non-communicable diseases, and it's about injuries and death from violence. So the majority of children under 5 dying from diseases that we can prevent. And if you look at this chart again, on the right-hand side, you're going to see the year 2017. The caseload of death globally has increased to 55+ million, given that we are more people. But what you see there, less than 6 million children under 5 are dying. So if you would put these two pie charts next to each other, you would already understand we were nearly half the death rate of children under 5 in the span of less than 30 years. It's a remarkable achievement. And I will tell you a little bit why, because this is not luck. That was not coincidence. And I'm going to make a bit of a passionate plea to multilateralism, to international cooperation, because in times where self-interest and nationalism is on the rise, especially in further developed countries, it's always important to remind ourselves of the importance of working internationally. So the next slide is going to show you something that has 2 different stories in it. The top is looking at some of the biggest killers of children. It is malaria, it is HIV, and it's measles. Over time, between 1990 and 2017, you see an increase in the death count, especially in the 90s and the early 2000s. And around 2006-07, where the world was grappling with the financial crisis and we were worried about the home ownership, about retirement accounts, the world seen something so remarkable, but we were so busy with negativity that we didn't even pay attention to it. We turned the tide on some of the biggest killers of diseases. You see there's peak in 2007, and since that you've seen the fastest decline of death from these diseases, something I try to find a good comparator, but there's not a lot that we can point to that say the speed of progress, the speed of saving lives is matched by other interventions. It's remarkable, but why did it happen? Because in the year 2000, the world came together with the Millennium Development Goals, said we have 8 goals for this world, we have a plan to measure it, and we have the political will to work together in a global cooperation. And at the same time, we also put money where our mouth is. So the bottom chart overlays the same time period with how much the world invested in health of people that are normally cut out of the health system globally. And you see there's an increase in spending in health. And you see a decrease in the counts of death, especially young, especially the vulnerability. A remarkable story totally gets lost in our daily news cycle about negativity. And I want to give you another reason, another example why it's important to be optimistic. So this is me filming myself doing a little bit on my screen here. So you see a chart. Every yellow dot represents a country that introduced pneumococcal vaccine in the year 2008. Now I'm moving the slider, and you see more countries are coming up. These countries are divided in 4 different clusters: high income, upper middle income, lower middle income, and low income. As you can see, the early adopters of new vaccines were countries with a strong health system that could afford it. In the year 2000, also, Gavi, the Global Alliance for Vaccine Innovation, started. It is one of a set of remarkable institutions that built a health delivery network that can really reach kids and young adults in places that were normally cut off. So if you go back to that slide, every dot that you see there that is purple or that is blue is a country that only got access to these vaccines because we invested in these global institutions. Without these institutions, without the political will to say, yes, we make these drugs available for everyone in the world, we would not be able to reach the kids in more than half of the countries worldwide. So why is it important to communicate this progress? Because what we see, the cost of doing that is vastly overestimated. The actual portion of the GDP of this country or any OECD country is, by any citizen, vastly overestimated compared to how much it really costs. We pay less than 1% of our GDP goes into these kind of international foreign aid institutions. But at the same time, we completely underestimate the progress that the world has been doing. If you ask people today, is there more or less poverty in the world today than 20 years ago? 73% of the people won't get it right. We're less. People think we are more. People, because of a lot of struggles and a lot of what you work in, and looking at your vertical, you will believe, yeah, it's getting worse. It is getting better. It's important to communicate this because when people believe that progress is real, people are also more supportive of working on it. And that is a very important and complex motivation that we're trying to convey here. And at the end of the day, why it matters, I want to show you one more map. And that is the world map taking 3 indicators. The under 5 mortality, so what are the odds of you dying under 5? What are the odds of you growing up and stunted and malnourished? And the odds of you being able to read and write when you grow up. Very basic concepts of global health. We want people to be healthy. We want people to be able to live to their fullest potential, to become someone. And what you see here is every time a dot goes up, statistically, a kid is born in that specific country. Every blink represents 1 birth. And you can see there are some places where it's green, there are some places where it skews toward red. Where you're born is completely out of your control. But it's our moral imperative to make sure wherever you're born, you have the same chances in life to be productive. And that's what global health is about. And the only way we can do that is to remind people how much we have achieved over the last 30 years. Because it's very easy to get down in a vertical and only focus on that. But from time to time, it's good to take a step back and look at what we've accomplished, because it gives us also the motivation and the conviction that we can do more in the next 30 years. So one day, with you change makers and your voice in health, we can turn this map even further to the green. Thank you.